and thank you all for coming to the 7th Annual State of Hunger, whether you're here with us or tuning in virtually. We appreciate you all joining us at this critical time to address our community's needs, to ensure every San Diegan can access 3 nutritious meals every day. I'd like to thank our event sponsors, California Southern Small Business Development Corporation, Qualcomm, Jacobson Cushman, San Diego Food Bank, Feeding San Diego, Kaiser Permanente, and UC San Diego Health. Your generosity and support of our mission provides us this space for San Diego Hunger Coalition to share data and resources to best support the amazing work everyone in this room is already doing to end hunger in San Diego County. Thank you to our board of directors, whose combined expertise and support provides opportunities to connect to new audiences, create new partnerships, and help to ensure we can remain a strong partner to any organization combating hunger. Over the last 50 years, what began as holiday food drives quickly grew into a powerful force for policy and systems change. For the last 5, I've watched this organization adapt to a pandemic and unprecedented obstacles to getting food in people's hands, and evolve into a data-informed and community-driven group dedicated to measuring the need and providing the resources necessary to meet it. I'm grateful to work alongside each member of our staff, past and present, to help us move closer to a hunger-free San Diego. I'd now like to turn it over to our CEO and President, Alondra Alvarado, who leads our team with all the fierce passion and genuine care we could all hope for in a boss.
Thank you, Sara, and buenas tardes a todos y todas. Also, the people we have some people join through Zoom, so that's why you're seeing the Zoom settings up there. I also want to thank the Mingue Museum for this beautiful space. They're hosting us today, so I really appreciate. Hopefully, like next during your plans, you can come and visit the museum. It's very, very interactive and very fun. I also want to thank our volunteers who are helping us with the registration and setup and everything. It's great to have people who are committed to our work. Also, thank you all for being here today at our 7th Annual State of Hunger. As you know, we gather every year for one reason, and it's because hunger in San Diego is real, it's growing, and it should never be hidden. Earlier this year, as you know, the USDA stopped tracking hunger at the federal level. They stopped counting. But here in San Diego, we won't look away. We'll keep measuring, keep reporting, and keep telling the truth because data is dignity. And if we don't keep record of hunger, it becomes too easy for others to pretend it isn't there. I want to share something personal. When I was a kid, I remember watching my mom skipping meals. At that time, I didn't understand it. It felt very normal. I thought it was something that grown-ups do. And then when it wasn't until I was older when I realized why she was doing that. She skipped meals so I could eat. No parent should ever have to make that choice. No older adult should be cutting their medications in half because the month run long. And no parent should be choosing between rent and groceries. No niece or nephew in this region should be going to school on an empty stomach. These aren't statistics. These are our families. And still, despite all the headwinds, federal cuts, shifting rules, uncertainty at every level, San Diego shows up for each other. When Washington doesn't seem to care, when local governments are figuring out how to implement solutions, when leaders need rigorous data to make real decisions that put food on people's tables, we are here. That's the purpose of today. We come together as a hunger relief sector to face the reality of hunger with honesty, to share what the data tells us, and to commit to action that's rooted in dignity and community. Hunger is solvable. It takes coordination, courage, and the kind of persistent collective leadership in this room. Thank you all for being part of this work. And before I move on, I also want to acknowledge my team. This is a group of people who show up every day with discipline, heart, and a stubborn commitment to getting the details right. The research, the training, the partnerships, and when the work gets hard, which apparently has been every 20 seconds this year, they keep pushing because they know what's at stake for the families we serve. Thank you, Sara, Joseph, Anna, and Andrew for your leadership, your grit, and your belief in this mission. I'm honored to do this work with you guys. I also like to acknowledge some of the elected officials and representatives in the room. Thank you for joining us today. Leaders who understand that nutrition security is essential to a thriving region. Thank you for being here, for your partnership, and for recognizing that hunger is not a side issue, it's a core responsibility of government. We appreciate your commitment ensuring every San Diegan has access to the food they need. On that note, please join me in watching this message from one of our strong leaders in DC, Congressman Mike Levin.
Hi, everyone. I'm Congressman Mike Levin, and I'm proud to represent California's 49th Congressional District, which includes North County, San Diego, and South Orange County. I'm so pleased to partner with organizations like the San Diego Hunger Coalition, who are on the front lines of fighting hunger in our community. And this work has never been more critical than it is right now. That's as we saw this past month during the government shutdown. Without federal food assistance, a lot of families were left wondering how they were going to put food on the table. This impacted thousands and thousands of San Diegans who turned to many of your organizations for support. And people who rely on SNAP, they aren't refusing to work. Most are hardworking seniors, they're veterans, they're families with children who struggle to make ends meet. And before the shutdown even began, USDA was targeting SNAP and reducing help for people in need. That's completely unacceptable and immoral in my view. So I thank you for all your hard work and dedication during this difficult time. I thank you for your continued service to our community and all that you do for our community members. And I look forward to continuing to partner with organizations just like yours to ensure that every person in our great community has enough to eat. Thank you all again for all the work that you do.
Thank you to Congressman Mike Levin for their help. Also, I'm pleased to introduce Joseph Kendrick, our research manager. Joseph joined the Hunger Coalition in 2022, and he comes to this work with a background in applied mathematics and labor economics, and previously served with the Bureau of Labor Statistics. His commitment to data, policy, and anti-poverty work has strengthened our ability to tell the truth about hunger in San Diego. I always say he's also the person who makes me look smart because he's the one who gives me the talking points and I repeat them. So please join me in welcoming Joseph.
Thank you, Alondra, and thank you all for being here. Today, I'd like to focus on and explain what our most recent research demonstrates about the current state of hunger in San Diego County. I'll start with a brief overview of our methodology and vision, and then provide the statistics, maps, and dashboards from our most recent research. And then we can get into the why question as to why we're seeing these numbers and what impacts the federal government is having on hunger here in San Diego. So to begin, I'd like to show our vision for a hunger-free San Diego, which was established and guided by our Hunger-Free San Diego Advisory Board, whose 30+ members were shown just moments ago. We look forward to and are hopeful about a future San Diego in which anyone experiencing nutrition insecurity can readily access healthy, equitable, and culturally appropriate food assistance to safely see them through their time of need. To achieve this goal, our research, which I'm about to show, I would have to consistently demonstrate no meal gap, which we do think is possible. Now onto the methodology. To calculate this meal gap every single month, which is the number of meals that would have been required for everyone in the county to have access to 3 meals a day in that month, we first have to estimate how many people can't afford to purchase 3 meals per day on their own income. These are our nutrition insecurity estimates. Once we have the number of people that can't afford 3 meals per day at the zip code level, we can then estimate how many meals they're able to provide for themselves by estimating how much families spend on food every month at each income threshold. This gives us the total self-purchased meals. Then to estimate the number of meals nutrition insecure people are receiving from food assistance organizations, we reach out to about 20 of the largest providers of food assistance each month, many of which are on the advisory board, as well as state and local agencies to get an estimate on the total number of food assistance meals that were distributed in that month at each zip code. And then subtracting the total meals needed by the self-purchase totals and by the total food assistance received, we can then calculate this meal gap, which this formula at the bottom summarizes nicely, which shows where hungry people are and exactly how many meals are needed every month. We're currently operating on about a 3-month time lag in reporting this data, and we're trying to cut down every way we can to make that sooner so we can report the data as soon as possible. If you've been following us for the last few years, you might notice that we're now using 225% of the federal poverty level instead of 200%. I'd like to just briefly explain that. The official federal poverty level is a nationwide threshold by which Americans are considered to be living in poverty, updated for national levels of inflation every year, but it's widely considered to be inaccurate, undercounting the total need, especially in areas that are as expensive as San Diego County. While 200% of the federal poverty level has been a common threshold used to replace what an actual threshold for poverty might look like, the last 2 years have shown that this even higher level is slowly becoming inadequate as local San Diego inflation continues to outpace the national average. This is because census, USDA, and all cost of living calculators show that poverty and hunger are getting worse, but the official number of people under 200% of the federal poverty level has been decreasing, showing that it's no longer keeping up with the recent bouts of inflation here in San Diego, or accurately measuring the recent increases in hunger and poverty. Thus, with the help of and collaboration of some students at the University of California, San Diego, the master's students in computational social science, we were able to adjust the federal poverty level from as early as we could for San Diego inflation levels rather than national inflation, which show that if poverty kept up with the inflation measures we have here in San Diego, it would be almost at exactly 225% of the federal poverty level. And this most recent increase this increase can mostly be attributed to the last few years as we've seen San Diego inflation skyrocket a lot more than the national average. So as a result, we've adjusted our methodology to consider anyone under 225% now nutrition insecure, which you can see here on the right with the table. Anyone that's living alone making under $35,000 of income is considered nutrition insecure, or anybody in a family of 4 under $72,000 of income. I'd also like to point out that all cost of living calculators for San Diego County show that somebody actually needs to make quite a bit more than 225% to actually comfortably afford all necessities. So we're confident that this is still a conservative estimate, but a good measure that we hope we can all agree on, that nobody should be expected to make ends meet and to also afford a nutritious diet at this level. So with all that background, we can now get into the actual data itself, starting with the numbers in nutrition and security. We normally report numbers at the end of each quarter. So we report March, June, September, and December data, but the government shutdown meant that they were not, and they still aren't, currently releasing the monthly statistics that our methodology relies on to report this data. And I'll speak more to that later. But for now, we're estimating August, and I'll get to September as soon as we can when that data is released. In August, we estimate that more than 1 in 4 people in San Diego County, or about 850,000 total people, cannot afford 3 nutritious meals per day. This is up to nearly 1 in 3 children, more than 1 in 4 older adults, and almost 2 in every 5 people living with disabilities. Nutrition insecurity has been steadily rising for the last 3 years. As the chart on the left here shows that we reached a decade low of about 22% in September 2022, coming out of the pandemic, when there were several federal programs in place to provide more to low-income families and higher benefit amounts, as well as increased funding to state and local organizations were helping. As those programs expired and prices continued to rise, though, families have lost purchasing power and are now facing the highest levels of nutrition insecurity that we've seen since 2020 in the first few months of the pandemic. And this image on the right is a screenshot of one of our interactive Tableau maps, which is on our website. You can hover over each zip code to see its numbers or filter by certain buckets, supervisors districts, or HHSA regions. We also have an accompanying nutrition and security rate map, which shows the relative amount of need in smaller areas with lower populations, such as places in East County that don't get the spotlight that they deserve. We consistently see that some zip codes, and especially Southeast County, have 40 to 60% of the population living in nutrition insecurity. And then there's a June map over there. I've just updated the August map, so I'm trying to show August maps because we just finished that data, but there will be maps over there for after the panel if anybody wants to ask more questions or talk about this. So now once we have all those people that are nutrition insecure, we can then estimate the number of self-purchase meals they're able to secure with their own income. And here's a table breaking down some of the numbers for August. You can see that people below 50% of the federal poverty level are spending less than $5 a day on food, which means they need an average of 57 food assistance meals monthly in order to get 3 meals per day. And people between a higher threshold, like 185% to 200, are spending about $10 a day on food, meaning they need about 22 meals of food assistance per month and are providing 76% of the meals that they need to get 3 per day. And this is excluding any food assistance or CalFresh or any benefits. We have this data for many other income groups as well, and this allows us to see exactly how many meals would be needed by food assistance to avoid a meal gap monthly. Moving on to food assistance, here are two pie charts showing food assistance totals in 2 different months. The first chart on the left shows what food assistance looked like in December of 2022, when the pandemic was still declared an emergency at the federal level, and there were several programs in place that were providing millions of meals additionally per month. CalFresh emergency allotments increased all CalFresh household benefit amounts to the maximum, providing an additional 8 million meals per month to San Diego County. And the pandemic EBT program, in its third iteration, provided about 6.6 million meals to children that month as well. Both of these programs operated in many other months between 2020 and 2022, and it meant that more than 38 million meals were being provided to San Diegans in need. Then on the right, you can see how that compares to August of this year with a much smaller pie chart, of only 29 million meals provided by food assistance due to the loss of these federal programs. CalFresh provided still more than 16 million meals and about 55% of all assistance, but it was still several million short of the totals it achieved during COVID. And then the red slice on the pie chart shows that summer EBT, which was implemented after the end of the pandemic EBT program was eliminated, operates in summer months when children don't have access to school meals, and that provides about 1.7 million meals, far less than the 6.6 million that EBT provided. Food banks and pantries are definitely stepping up and increasing their output in any way that they can to meet the increased need that we're seeing this year, but the result is still drastically less food support and a higher meal gap. About 86% of the estimated need for assistance was met in August, but this leaves a shortfall of about 4.4 million meals in that month alone. University City, Escondido, and College Grove all reported the highest meal gaps, which are some of the usual suspects that we see having the highest remaining unmet need. More than anything, this data shows that more resources are needed in these regions to get nutrition insecure families enrolled in food assistance programs that can help reduce the meal gap. And this map on the right provides a countywide view of all the areas with highest unmet need. On the website, you can hover over each zip code to see how many missing meals were in your zip code, with the darker zip codes representing a higher meal gap. Even with the recent and coming cuts to CalFresh, we still believe that it remains the most reliable method to closing this meal gap. We published 2 different maps on CalFresh participation, one on the participation rate and this one on the right, which shows where the most eligible enrollees are located throughout the county. We're already seeing a drop in the CalFresh participation rate even before the government shutdown, with nearly 15,000 people less enrolled in the program than last December, and the participation rate, which represents the percentage of eligible people that are enrolled, dropping from 70% down to 67%. And this map shows that there are still about 188,000 unenrolled but eligible people around the county. And because of the CalFresh multiplier, which I'll talk about more in a bit, that would add another $62 million in local economic activity if everyone who was eligible was enrolled. And this would go a long way in boosting the San Diego economy at a time when it really needs it. All the information I presented thus far is summarized in our one-page dashboard that we post on our website quarterly with the info, nutrition and security, food assistance, self-purchase meals, the meal gap, and CalFresh participation. This dashboard here is for the entire county, but we also publish one for each electoral district, including Board of Supervisors districts, congressional, state assembly, state senate, and city council. And since we just finished this August data, I don't yet have the August dashboards done. There's also a dashboard of June data over there. And feel free to ask me any questions about that as well after the panel. So now with all the data here, I'd like to get more into the why question, why we're seeing this increase and what's been driving it this year. The first factor I'd like to mention is the overlap with unemployment. Unemployment has been steadily increasing this year with more than 80,000 San Diegans actively seeking work and being unable to find it. The unemployment rate, which is already a drastic underestimate of the number of people not working, has risen from 4% to over 5% this year. Southern California is experiencing the highest rates of unemployment in the nation. The chart here from the FRED database shows that, like nutrition and security, unemployment is the highest it's been since the economic crisis brought on by COVID. In addition to unemployment, other factors like inflation, housing costs, and debt are all also making it a lot harder for families to afford food. As previously mentioned, the San Diego-Carlsbad metro region continues to see the highest year-over-year inflation rate, with another 3.9% increase in general prices in September, which is the only important data point that I've seen continue to be posted despite the shutdown. The general cost of living, incorporating things like rent or housing, food, healthcare, transportation, is now nearly 30% higher than it was in 2020, and workers are not seeing an accompanying 30% increase in wages, leading to more poverty and an increased strain on purchasing power. Housing is another major crisis here in San Diego. Although there actually are more homes than families in this county, thousands continue to get denied shelter requests, with only 13% of all shelter requests being fulfilled, meaning that about 87% of people who ask for a bed from the city are given one, or not given one. And with the increased prices, San Diegans are forced to rely on credit cards or other forms of debt just to try to stay afloat. The average family in San Diego is in $16,000 of credit card debt. And with interest rates still near or above 20% on those credit cards, that means that their total owed will increase far beyond that and take years, if not decades, to pay off. I'd also like to note that Chula Vista has the second most credit card debt of any city in the nation, with an average of $21,000 owed per household. On top of the general economic concerns with wages, prices, debt, tariffs and federal policy, as well as the longest government shutdown in U.S. history, is only making things worse. This summer, the Yale Budget Lab estimated that average families will have to pay an additional $2,400 in price increases because of the coming tariffs, which I think already accounts for some of the inflation we've seen this year. But we're definitely still waiting to see some of the effects that these tariffs have had, as many employers reported stockpiling goods to avoid paying the tariffs for as long as they possibly could. And food has been hit particularly the hardest. I know that the Trump administration is now talking about rolling back some of those tariffs on food because we've already seen such high increases in food prices. All these economic issues combine to create a grim picture for San Diego and for the national economies. Prices are increasing, tariffs will likely make that worse. Unemployment is increasing, and wages are not keeping up. I've seen a few too many statistics that say that some economic indicator hasn't been this high since 2009, which I think should be the warning sign of all warning signs, as I'm sure we all remember the Great Recession. While I often focus on the data side of this issue, I don't talk enough about the human side of this and the effects that this has on real families, whether they be physical or psychological. The Hospital Association of San Diego and Imperial Counties releases an excellent report every year, but I wanted to highlight this year's main and recurring finding from that report, which was the great stress that the cost of living, things like racism and prejudice, COVID-19, and recent public health emergencies are having on San Diegans. For more info on the human and health side of these issues, I'd highly recommend checking out that report to see what people are saying about what is causing them all this stress and how they're dealing with it. As if all that weren't enough, HR 1 and the current government shutdown has created a lot more uncertainty on the best program that we've had to fight hunger. As a result of the shutdown, local food banks and nonprofits have shouldered a lot of this burden. The food banks stepped up with spending hundreds of thousands of dollars more to meet the demand and feed as many people as possible in a time of great need, with no November CalFresh benefits going out for the first 7 days of November. And now with CalFresh going out after far too much drama, I wanted to show some of the data points on what it would mean for CalFresh if it didn't go out and what that would mean for San Diegans. Just 1 month without benefits would mean about $73 million lost in issuances and a subsequent $130 million lost in economic activity, since studies show that every $1 issued in CalFresh benefits results in another $1.79 in local economic activity, because this money is reused or multiplied to stimulate local businesses. Any pause or cancellation of benefits hurts the entire region. That's not just those going hungry, but this economic multiplier does have a pretty big, drastic effect on our economy as a whole. 1 month without benefits would also increase the meal gap by 16 million meals, likely pushing it over 20 million meals in that month, depending on which month it is. This would have detrimental effects on nutrition insecure families in that month, even if it's temporary. As you can probably tell with the mention of pivoting between June, August, and September data, the shutdown is also severely limiting our ability to track hunger, although our research doesn't rely on that USDA food insecurity survey that was just canceled. The shutdown has meant that they've essentially halted all operations from the Bureau of Labor Statistics and the Census Bureau, which we rely on to make these estimates every single month. We still don't know how wages, poverty, unemployment, or labor force numbers fared in September, and yearly updates to data sets have been entirely stopped as federal workers were not allowed to continue their essential work to report on the U.S. economy during the shutdown. And even without the shutdown, SNAP is already on the chopping block with the reconciliation bill that was passed this summer, which will require the county to review about 96,000 people on CalFresh to determine whether their benefits need to be terminated according to the new rules, and the direct cancellation of another 13,000 CalFresh recipients directly. The Center on Budget and Policy Priorities estimates that as many as 67,000 CalFresh enrollees will be removed from the program, which is about 17% of the entire program in this county. If 67,000 people lose access to CalFresh, it would mean an increase in the meal gap by roughly 2.7 million meals monthly and remove about $250 million per year from the local economy because of the CalFresh multiplier. Another $300 million in costs will also shift to state or local governments, meaning there will be a total economic impact of $550 million at least due to this bill. And these are just for the changes to SNAP, not including everything else or the Medicare cuts as well. And we're definitely already seeing the consequences of this bill, whether it's by increased denials or people simply being too scared to apply or renew, with the CalFresh participation rate dropping, as I mentioned, from 70 to 67%, and nearly 15,000 people less on the program. To summarize, hunger in San Diego is worsening, and because of the economic downturn and recent federal policy, the food system will continue to struggle for the foreseeable future. HR 1 contains stricter work requirements, reduced eligibility for veterans, older adults, immigrants, and those who remain on CalFresh might see decreases in their benefit amounts. Crucial programs like SNAP education and medically tailored meals are being slashed, reducing the availability of community gardens, nutrition classes, and thousands of meals for people with illnesses. The result will be increased strain on the local government and food assistance organizations to try to meet this increased need, and we foresee more increases in nutrition insecurity or the meal gap as a consequence. Food system needs help from the community, whether that be by donating, volunteering, advocating, or legislating. We believe that food is a human right, and programs to provide something as essential as food must be expanded, not decreased or toyed with in political negotiations. Thank you, and with that, hopefully I've set up Anna, our community impact manager, who can speak more to these changes to CalFresh and other food assistance programs.
So hi everyone, I'm Anae Evangelista. I'm the Community Impact Manager for the San Diego Hunger Coalition. As Joseph mentioned, there are many here in our city who are affected by nutrition insecurity, and that means that they can't access 3 nutritious meals a day. There are several food resources available to combat hunger, but one of the major programs that Joseph highlighted and that I want to take the time to highlight is CalFresh. It is also known as SNAP in other states, but here in California, we call it CalFresh. It is a federal food assistance program, and it provides eligible families with EBT benefits that they can use to purchase groceries at participating grocery stores and farmers markets. These benefits get delivered on an EBT card. We have a little picture of what that card looks like right here on the slide. And to give you some context, a family of 4 could receive between $24 to $994 a month in EBT benefits based on their income and their expenses. CalFresh not only provides people with access to food, but we love to highlight it because it is a program that provides families with the power of choice. With EBT benefits, as long as they're at a grocery store that accepts CalFresh, they can purchase any food item. And that really allows families to access not only nutritious foods, but foods that are culturally appropriate to them and their families. CalFresh is an incredibly crucial program in our county. Joseph spent a lot of time highlighting, how many meals CalFresh actually provides for our city. But I did just want to highlight and give some specific numbers for how many in San Diego actually rely on the program. In San Diego County alone, there are roughly 400,000 people who, again, are currently on CalFresh. Of these 400,000, over half of these are children, so age 0 to 18, or older adults, so those age 60 or older. To get into some specific numbers, that means in San Diego, there are about 125,000 children and almost 100,000 older adults on CalFresh at this time. The federal shutdown did come to a close last week, but it is still really important to highlight these numbers because this shows that these are the vulnerable populations who are most affected. These are the people who lost access to food, who lost access to their benefits, who couldn't afford to eat for the week while we had the federal shutdown. And unfortunately, like Joseph pointed out earlier, there are changes coming to the CalFresh program that I just want to take the time to highlight and explain because there are a lot of changes coming and they can be quite confusing. There are changes coming due to a federal budget reconciliation bill, HR 1, that passed earlier this year. This includes changes to immigrant eligibility, ABOD policy rules, administrative costs, and a loss of funding for CalFresh nutrition education. And I will get into detail for all of these in the next few slides. The first one I just want to take the time to highlight is changes to immigrant eligibility. So right now, you don't have to be a US citizen to qualify for CalFresh. For example, you could be a Cuban or Haitian entrant, or right now you could be a refugee and you would still qualify for the program. But unfortunately, with the budget reconciliation bill that passed, the list of non-citizens who are eligible for CalFresh will become severely limited. And many immigrants are actually going to lose their ability to access the program. And on the slide here, I just wanted to highlight which immigrants exactly are standing to lose access to the benefits once these effects actually take place. This does include immigrants like refugees, asylees, and survivors of domestic violence and human trafficking, so UNT visa holders. All of these people, all of these individuals, families, children, stand to lose their eligibility for CalFresh benefits. There are other changes coming that I just want to highlight as well, and this includes changes to ABOD rules. Some of you may have heard ABOD tossed around, but ABOD stands for able-bodied adults without dependents, and it is a federal rule that limits the amount of time that someone can be on CalFresh. It limits individuals to a maximum of 3 months out of a 3-year time period if they do not work or if they do not meet any work exemptions. Originally, California qualified for a waiver to this rule, and it was supposed to last until January 31st of 2026. But unfortunately, as of early November, it has come to a premature end, and San Diego County is losing its ability to renew it as well. So many people are going to have to soon prove that they work or meet work requirements in order to prevent them from losing benefits. And I will say it isn't easy for folks to prove that they meet work requirements. The ABOD rules are actually getting much stricter. With the passing of HR 1, we are going to see an elimination of work requirement exemptions for people who are experiencing homelessness, veterans, and individuals under the age of 24 who aged out of foster care. So again, this means that these individuals who were previously exempt under the rule are now going to be required to prove that they meet work requirements in order to continue receiving their CalFresh benefits. The age range affected by ABOD rules is also being expanded. Previously, ABOD only affected those who were aged 54 or younger, but again, it is expanding to those aged 64 or younger. So if they do not work, they can only receive those benefits for that 3 months maximum in that 3-year period. The rule is also expanding to include families with children age 14 or older. So even though they do have dependents, they are going to be forced to meet work requirements because their child is, again, age 14 or older. And unfortunately, the federal government will be shifting more of the administrative costs to the state. And so the state of California is going to have to bear a much higher burden when it comes to keeping the CalFresh program and administration costs funded. Although it is, although on paper it looks like the state is going to have to, bring more funding, this funding burden will trickle down to the counties as well. And although the state and the county are going to do their best to prepare for this shift, it is unfortunately going to mean an increased burden for continuing and existing county staff. It may also mean an increased wait time for those families who call the county using the phone line. And unfortunately, it will just ultimately mean a harder time overall for families who are applying for CalFresh and who are trying to renew their CalFresh benefits. It's really just going to make it harder for those in need. And because of the changes coming to SNAP, I do just want to take the time to highlight all of the other food assistance resources that are available here in San Diego County. There are many, as you can see on the slide here, including WIC, Sunbucks, congregate meals, home delivered meals. And the first one I just want to take the time to spotlight is WIC, which stands for Women, Infants, and Children. This is a federally funded food program dedicated to supporting low-income pregnant individuals, along with their infants and children under the age of 5. So WIC helps families by providing monthly benefits. Families who qualify are going to receive a WIC EBT card that they can use to purchase specific approved healthy foods. These must be foods that are tailored to meet nutritional needs during pregnancy and early childhood. WIC also provides these individuals with nutrition education so they can attend classes on topics where they can learn things like learning healthy eating habits and learning infant feeding cues. And lastly, they also provide breastfeeding support. So they offer individual and group sessions, lactation peer support, and access to lactation consulting. So it is a really great program for pregnant individuals, their young children, or anyone who was recently pregnant, including those who are postpartum or breastfeeding. Unlike CalFresh, I just want to highlight, WIC does not count military housing stipends as income, so it will not affect your eligibility for the program. And additionally, dads, grandparents, and other caregivers can apply for WIC benefits on behalf of the child. There are WIC offices available all over San Diego County who can help you apply for the program, help you learn more about it, and we have a number of wonderful partners who offer these WIC services that I just wanted to give a little shout out to, including the American Red Cross and SDSU WIC. But it really is easy to find an office. You can just go to sdwic.com. There is a little form that you would fill out with your address, and it'll provide you with the options closest to you. But all of these offices also provide the option to apply for WIC over the phone and online, so they really make it easy for families to access. Sunbucks, or Summer EBT, is another food program that I just want to highlight as well. It is available for families with school-age children. And this is a federal program that was developed and implemented back in 2024 with the aim of bridging the hunger gap during the summer. During summer breaks, children lose access to free school lunch and breakfast meals. And so, again, Sunbucks was made to combat this and help children still gain access to food. Each eligible child in the family gets $120 worth of food benefits. And these children, they can spend it at any grocery store that accepts CalFresh. And I want to note as well, children who are on CalFresh are actually automatically eligible for the program. Every year as summer approaches, the San Diego Hunger Coalition actually hosts a Sunbucks training. We host these virtually, and we also offer a few other options. So, come 2026, we would love to invite you all to take a Sunbucks training with us, get connected to some of our partners and schools who can provide assistance in getting on Sunbucks. And for those who work with older adults, there are several meal options available as well. One resource we want to highlight is Congregate Meal. Different providers provide free meals for older adults all over San Diego County. HHSA, or the Health and Human Services Agency, is contracted with several different partner organizations across San Diego County. And they have a list of these congregate meals available on their website. Any older adult can show up and get a warm meal. For example, Serving Seniors is one organization we want to highlight. They have several congregate meal sites, again, all over San Diego County. You can actually see a picture of our team here volunteering at one of their downtown locations. Congregate meals can be a fantastic way for older adults to, again, get access to a warm meal and get some social interaction as well. For those who are unable to go in person to get their meals, there are several home-delivered meal options available as well. For example, Meals on Wheels is another fantastic organization, and they provide nutritious home-delivered meals for anyone age 60 or older, or disabled veterans as well. For anyone interested in getting connected to Meals on Wheels, I know Brent is here from the organization. He's waving in the crowd. So if you'd like to talk with him later on, please feel free to. But there are also free medically tailored meals. Joseph mentioned that some of these programs are also getting cut, but it is still available. So medically tailored meals, anyone on Medi-Cal with a qualifying medical condition can get approved to get free home delivered meals. One organization that actually provides these is Mom's Meal. But I just want to say both of these programs provide nutritious meals straight to your client's door, brought by volunteers. So it really is a great way for families or older adults to still gain access to meals, even if they can't go in person to get them. And lastly, I just want to highlight the San Diego Food Bank and Feeding San Diego. They do amazing work in setting up food distributions and food pantries all over the county. They also have mobile food pantries as well. They have maps available on their website where you can actually see the closest distribution to your area. And they make it really easy. You can actually filter through the maps to see things like senior-only distributions, to see specific dates that a distribution will be open. So they are another amazing resource for families who need emergency food access. So if you can't wait for your CalFresh application or your WIC application to be approved, again, this is an amazing way to get access to that emergency food. And I will say, I did go over all of these food programs quite briefly, and there are more programs that you can definitely take the time to learn about. If you are interested in learning more in-depth information, our organization hosts monthly hunger-free navigator trainings, where we go over each of these food programs in really great detail. We cover things like eligibility for the program, information on how to best get connected, who you can contact or email. So if you are interested, I would encourage you to take our trainings. They are just going to be listed on our website. And of course, we're always aiming to increase access to food. That is our ultimate goal. In order to support outreach work, our organization has developed a number of different resources, including toolkits that you can utilize when doing this work. Some of our toolkits include best practices for outreaching to people like special populations, so people who might experience, the application process a little differently, or who may face different eligibility rules, so including people like college students, older adults, or immigrant families. And so I would encourage you to check out our website. We have a list of different, again, toolkits and flyers available. And if you're ever interested in learning more about a specific one, you can always feel free to reach out to me as well. And lastly, I do just want to end off by highlighting our amazing CalFresh subcontractors and partners. I know there are a few of them in the crowd here. This past year, the San Diego Hunger Coalition has been able to train over 1,600 CalFresh assisters through our monthly trainings. And our subcontractors have been able to perform roughly 30,000 CalFresh pre-screens. So they've been able to connect that many people to CalFresh information. And they've been able to submit roughly 6,000 CalFresh applications. The work isn't easy. Joseph and Alondra highlighted earlier how much turbulence there's been in the past year, how much changes are coming or have already came. but we have an amazing network of partners who do their best to make sure that each one in their community can access food. So I wanted to highlight them. They are amazing. And with that, that was my presentation. I do just want to pass it over to Angelis Nelson, the policy advocate from Nourish California, as she will be moderating our panel today.
Good. Yes, thank you. Thank you for being here with us today, fighting hunger in our communities. My name is Evangelista Nelson. I am food advocate for North California. And we have a really important panel of advocates at the local level, at the state level, and at the national level. And I'm really happy to introduce them to you to discuss this very serious issue with HR 1. We're going to focus on this bill that is going to cause a lot of harm in our communities. And I'll start by introducing Blanca Melendres. She is the Executive Director at UC San Diego Center for Community Health. She's a public health executive with nearly 3 decades of experience advancing food and health equity across California. She leads statewide initiatives and programs, forming partnership with community-based organizations, farmers, clinics, school districts, and public agencies to reshape food systems toward equity and self-determination. Her work has helped expand community design nutrition incentive initiatives, including Más Fresco and Food as Medicine, and the California Fruit and Vegetable EBT pilot, boosting access to fresh produce while strengthening local food economies. Blanca co-develops governance and research frameworks that center lived expertise, ensuring community leadership drives decisions that address root causes of health disparities and strengthen local health systems. She leads with the belief that health is a human right, as many of us do, and that equity is achieved not by doing more for communities, but by building systems in which communities live. Thank you, Blanca, for being here. Amy, I'll go with Amy Eltz, Director of Programs at the San Diego Food Bank. Amy Eltz joined the San Diego Food Bank as the Director of Programs in 2023, bringing over 15 years of experience in the nonprofit sector, both domestically and internationally. Amy has worked in various areas of the sector, including military support, women's and girls empowerment, recreation, youth development, and community development. Amy previously taught courses in nonprofit leadership and community events at the San Jose State University. She holds an undergraduate degree from the San Jose State University and a master's of public administration from San Francisco State University. She currently serves on the State Public Affairs Committee for the Junior Leagues of California. Thank you, Amy. And then I have a couple of incredible advocates from the state. Gabby Davidson. Gabby is the current government relations manager at the California Association of Food Banks, where she has worked since 2022 to advance anti-hunger policies at both the federal and the state level to support the collective efforts to end hunger in California. She was previously at the Second Harvest Food Bank of Santa Cruz County as a community outreach coordinator, where she assisted clients with the coverage application process. Thank you, Gavin. And then lastly, but not last, Benjamin Chow, Ben. He's the Health and Public Benefits Policy Manager for the California Immigrant Policy Center. He is originally from Brunei and raised in Long Beach, California. Benjamin is a first-generation UC Berkeley graduate, currently organizing with the Community Immigration Policy Center. Their work spans immigration rights, housing justice, and community advocacy, with focus on collaborating with communities and coalitions to drive systems and policy change. Outside of work, Benjamin enjoys writing poetry and cooking dinner for close friends. Curious and adventurous by nature, they embrace new experiences and ideas. Though known to get carried away in coffee shop conversation, they believe meaningful change often begins with a simple chat. And please give him a warm welcome. And on that last note that change begins with that chat. I am really happy that you are all here to chat with these amazing advocates. And the topic that we want to cover today is really serious and maybe stressful for many California families. And knowing this moment, thank you, Joseph and Anna, for the incredible breakdown on the HR 1 policy. This bill was signed by President Donald Trump in July 4th. And it is a tremendous harmful bill for our communities. There's a lot of changes, and we're just going to cover a few of those and focus on the impact on our communities and the food systems and our communities that are participating in CalFresh. So I'll start with a question for Ben on immigrant communities, since you are an expert on that. And we know the HR 1 creates a lot of exclusions, new exclusions from CalFresh. Can you explain, Ben, who will be excluded and why? What families are going to be excluded and why those are going to be very harmful for our community and our families, especially our mixed status families?
Thank you, Angeles. Hi, everyone. Again, my name is Ben. Thank you for inviting me to speak today. So as Angeles mentioned, and as Anna summarized in the earlier presentation, at the California Immigrant Policy Center, we've been tracking this immigrant eligibility change to SNAP and CalFresh benefits. And I want to say that first, across the board, this eligibility change was not just to SNAP alone. It also impacted Medicaid, which we call Medi-Cal, access to of the Affordable Care Act marketplace, and to tax credits as well. So across the board, what we saw in HR 1 was the increase of exclusion of immigrants where they were historically eligible for these federally funded benefits. And we've been tracking this with our state, the Department of Social Services. And what we've learned since this bill was passed on July 4th is that it's going to have a pretty large impact in California. We anticipate at least 74,000 people are currently enrolled in CalFresh across the state who will lose their ability to access CalFresh once this goes into effect. And even during the government, during the government shutdown, we saw updates to this plan. I think it was on Halloween, USDA issued out their guidance finally and on their expectation for states to implement this. And the most shocking thing about it was they were telling states they expect them to begin implementing this the next day on November 1st. So we're in a really tricky spot here in California. And we're still waiting for our state to issue that guidance to counties. But yeah, as we've shared today, this is going to have a really concrete impact on families. These are humanitarian immigrants, people who have been provided lawful status as refugees, as asylum seekers, are granted parole, so protection from being deported from the US. And these are, they may be members of a household where people have a diverse set of immigrant statuses. And so a lot of our work at CIPC has been grounded in the idea that food is a human right. And what HR 1 is communicating to the country and to us in California is immigrants aren't welcome, and therefore it's not a right for them to have food. We believe across the board, regardless of who you are, where you were born, what you look like, you deserve access to food. And that's why at CIPC, we've been leading a campaign called Food for All, which is look to our state to step up and model what it looks like to have a truly inclusionary policy that includes immigrants. And so With that 74,000, I anticipate in San Diego being a county that is closer to the border, there may be a higher share of those humanitarian immigrants who have recently crossed the border or maybe fled from Afghanistan or Ukraine, who will soon no longer be able to apply and get help where they need it. So I just want to thank everyone here who works directly with immigrant communities, because over the next couple of years, as this rolls out, we're going to see an increased need for food, emergency services. And I think one thing that's given me hope is just seeing people step up and start, it reminds me a lot of the pandemic, with people doing mutual aid and rising to the occasion. And given HR1 and also the increase in ICE activity, people being kidnapped, it's almost like there's a disaster that's just impacting the immigrant community. And I'm seeing a lot of community members rise together and make sure we're addressing those harms.
Thank you, Ben. Yeah, this is one of the, I would say, most impactful parts of the bill. But there's also, there is a lot of them, but another one that I want us to cover is the harsh time limit, the work rules. But Gabby, if you can talk about how many Californians will be affected by those new time rules, and when will these changes take place? And also, as maybe include what will the effects on the food banks be?
Yeah, thank you. And thank you for the opportunity to be here. So, as was just mentioned in the previous presentation, these time limits are cruel, and they limit how long people who are subject to them can get CalFresh food benefits within a 3-year period. If you're subject to them and you're not meeting a work requirement or meeting another exemption, or you don't live in an area that has a waiver, then you're only able to get food for a limited amount of time. And we know that this is going to harm people with very low incomes, and it makes no one more able to or likely to work. It just makes people hungry. Unfortunately, due to the changes in HR1, and as a reminder, it will make more people, older adults, subject to the rule. And so rather than people 18 to 54 being subject, it increases that to people 18 to 64. Another, thing that was mentioned is it will make more parents subject to the rule. And so prior, if you had a dependent in your household who was under 18, you weren't subject to the rule. But now if you have a dependent 14 or older, you may be subject to the rule. And so, all of these, in addition to getting rid of the former foster youth and the unhoused exemption and the veteran exemption, it's just going to create more hunger in San Diego and across the state. The Department of Social Services has estimated that over 300,000 more people will be newly subject to the time limits. And that brings the total amount of people who are likely to be subject to these time limits up to 610,000. And we recently heard from the state that they estimate that about 18% of the 610,000 people are already working enough to meet that requirement, but that leaves over 80% who might be losing their benefits. And I think, then it's up to us and the state to really take action to help people screen for exemptions. You can be exempt from the rule if you're pregnant, or if you are having difficulty working or volunteering due to physical or mental health ability, including, if you're unhoused and you're unable to work because you don't have transportation or something like that. But even if people are subject, or even if people meet that exemption, they may have trouble reporting it. And so that's where community outreach workers will come in. And I think it'll just be support at the local level and the state level. We'll all have to work together to ensure that as many people as possible can keep their benefits. But unfortunately, we know that, in other states who have already started these work rules, a lot of people are being kicked off. And, we're grateful that the state agency is really taking their time before implementing this to train workers and look at the guidance. And so no one currently is subject to the work requirements, but we know that that's going to change soon. And as people are cut off of CalFresh, they're going to be coming to food banks and food pantries. And so at the state level, we're going to continue to ask and advocate for Cal Food funding, which allows our food banks to purchase California grown and produced food so that they can feed their communities. We know that CalFresh and food banks complement each other. A lot of people already visit both, even if they have CalFresh, because it's only on average $6 a day. And more people are likely to have to visit a food pantry if they lose access to these benefits. And so we're going to continue at the state level to advocate both to strengthen and protect CalFresh and also to strengthen our food bank resources so that when people turn to food banks, they're able to get the food that they need.
Thank you, Gabby. I think there's a lot of effects, not just losing coverage and losing access to food. And SNAP is not just a program or coverage, as we call them in California. It's not a program who provides food access. But I was talking to a community member, and she was sharing with me like all the other opportunities that the program brought to her family. And maybe Blanca, you can explain a little bit as a community the disruption that families have when there's disruption to coverage, what happens to their long-term health, what happens to the outcomes for our communities. And also, can you talk a little bit about the research, what the research actually says about work, wages, and why so many working adults still need a SNAP?
Good afternoon, everyone. Thank you for inviting me to be part of this panel. Before we talk about what research says, I think it's important to talk about what the community is telling us and what SNAP participants are saying. And for many, SNAP is not just a benefit or a dollar amount. For many is whether or not they're going to have time and stability to live a life. And a SNAP parent, for example, shared with me that for her, SNAP gives or takes time. Time to prepare a meal, time to breathe between bills, time to tell their children if they're going to be able to eat tonight or not. And the reality is that HR 1 and the government shutdown, what it's doing is really stealing time, stealing stability, stealing dignity, and stealing hope from our families. Our families tell us that they can plan a meal with less, but they cannot plan a future with a maybe. So our families continue to do everything they can. They are working, they are contributing, they are caregiving, and we keep asking them over and over to prove their worth in ways that it's not fair for them. So as we have this conversation, I think it's important that we ground ourselves also into what community is saying. They need dignity and they need to be treated with respect, and that aligns with what research is also saying. A couple research facts is that we know after decades of research in multiple states that when work requirements tighten, SNAP participation drops, but that doesn't mean that employment goes up. It doesn't. And it doesn't because people are already working. SNAP participants are already working, but they are working in jobs that are low wage, that are seasonal, that are part-time, that have unpredictable hours. So the problem is not what we are being told to believe, that SNAP participants don't work, that it's a work ethic issue. The problem is our unstable labor market. Another important effect of HR 1 is that we know after many, many years that one of the main effects of HR 1 is going to be disenrollment due to paperwork, failure. All that administrative burden that we are giving our families with SNAP. And over 85% of the SNAP sanctions happen because people are not able to submit their paperwork on time. And they're not able to submit their paperwork on time because they can't leave their work to go to the county office. They don't have a printer at home, right? They have unpredictable working schedules. There are many reasons as to why they can do this. And again, people will be dropped out of SNAP, not because they're not working, but because they're being asked to prove that they work in ways that are unreasonable when they are already stretched too much. And finally, we know that when SNAP is lost, hunger increases, and it worsens our healthcare outcomes. When SNAP is cut, we see a decrease in food intake. Families skipping meals, we just heard that someone saying earlier that. Parents prioritizing overwhelmingly the children over themselves. And then we also see the stress hormone cortisol spike. And that affects their sleep. That affects their insulin regulation. That affects their mental health, their hypertension. And research shows, epidemiologists, nutritionists, over 2 decades of research shows that increases hospitalization rates due to diabetes crisis, more ER visits due to hypertension, more diagnosis due to anxiety and depression. And we also see it in our school with kids with high rates of school absenteeism and low performing academic performance. So the research is clear. After decades of research and our community voice is clear, HR1 will not work. It will not increase employment. It will increase hunger. It will increase stress in our families, and it will increase illnesses. I'll stop there. I know we only have 5 minutes.
Thank you, Blanca. Yeah, we can discuss this for hours on the impact of our community. And I wanted to also give a space to for the food bank to let us know like what is the impact on the food bank, because with all these changes, there is increased burdens, there is an increased cost for the state, there is families who are leaving the program. So, could you talk a little bit about locally at the food bank? What is the impact?
Yeah, I think everyone in this room knows that when benefits are gone, it doesn't mean that the need is gone. So when we see these significant numbers of populations that are no longer going to have access, they're going to be turning to the food banks, many of them for the first time. So for context, right now at the San Diego Food Bank, we serve on average over 400,000 individuals every single month, both through our direct distributions as well as a network of 450 nonprofit partners. So seeing an increase in the number of people that are suddenly going to need additional need for us means that we have to increase our capacity to be able to get more donated items, to rescue more food, and to purchase more food to make it available to these communities. It also means increasing our logistics and our warehousing capabilities. But more importantly, it also means that we have to help increase the capability of all of our partners around the whole county. People from North County down to the South Bay are all going to have an increased need. And we need to make sure that they're getting food safely, that they're getting it equitably, and as much as possible, they're having a dignified experience where they can get that food from partners. The other piece that we need to lean into too, to some of Benjamin's points, is we need to grow and invest in our grassroots agencies that are trusted within the communities and are able to start pulling people in to receive services, not just in food, but in other self-sufficiency areas, because we are losing trust in the community. We are having people who do disenroll because they don't believe in the program and they believe that it's going to hurt their status in a lot of other areas. So for the food bank, we know we're prepared to grow. We don't love growing, but we're prepared to grow and to help our community partners grow as well, to help build back that trust and ensure that even though they don't have benefits, there's somewhere in the community that they can go to, that they trust that they can get food.
Thank you, Amy. And this is we're talking about the effects of HR1, but also we had a window of opportunity to see some of the effects of really not having access to coverage during the government shutdown, which was the government was shut down for over a month. And the impact in the community is immediate when families don't have access to coverage. So I wanted to see if you can maybe share a little bit, Amy, on what did you see in the ground on those days that families were expecting to receive the support from coverage and they didn't have it because it was delayed, and then also there were delays on applications, etc.
Yeah, we started seeing some of it even before October, before the shutdown. Fortunately, we have a pretty good government affairs team that had an eye on the situation, so we bought more food. To prepare ourselves, we started proactively reaching out to partners that we knew worked with some of those populations so that we could provide additional resources to them. Shortly after that, in October, our good friends at 211 were able to help us out with some data around the growing need that they were seeing. We pulled zip codes for high CalFresh usage areas and reached out to those partners to see what they were seeing and to help provide them with additional food for their communities.
We took the information that 211 was getting on the increase in calls for food assistance. It was up threefold for what it normally is. Some zip codes were seeing huge spikes on a daily basis of people calling in to find out for the first time how they can access food. So we were able to take that information and again, reach out to those zip codes in those communities to be able to provide additional resources. And that was just in October before the CalFresh delay happened. Leading up to that November 1st, we did start seeing more stories from our partners about an increase that they're seeing from anywhere from 30 to 1,000 additional households coming to these distributions. So when the benefits didn't hit, we started increasing allocations across the board to our partners that were in a lot of those high need areas because they were seeing an increase in households coming to them. We put on a large distribution on November 2nd to try and target some of those folks for an immediate need, served over 2,000 individuals. And then even this last weekend, we did a couple of additional distributions, this time with the county Live Well staff, so that we could not only connect them to food, but get them connected to some other resources and other ways that they could help find solutions to what they're facing. And then with our partners at Casa Familiar, again, they do great work around wraparound services. But we really wanted to provide not just food, but that connection to a resource, because there is still anxiety in these communities and there is still a lot of need. And that's going to taper off slowly, but we're still seeing that from that 7-day delay. People are still having issues with late bills, making ends meet and putting food on the table. So we were able to do some more connection work as well. We just got the numbers in for comparing September over October, and we're seeing about a 25 to 28% increase in the total number of people served. And that's not including the November yet. So we did see a huge spike once those benefits did not hit. But everything's trending as over 25% increase in just the number of people coming to us for the first time to gain food access.
Thank you, Amy. And I'm so glad that you're keeping track of what is happening month to month. Because as we heard before, the federal government has actually paused the tracking of what is happening and how hunger is being impacted, felt through the nation. So and thinking about that, I was maybe Gabby, if you can talk a little bit about what documenting the harm looks like and what data, what stories, what's surfacing at the state level, and also how that information can push us to move policies at the state level and at the federal level to limit the harm and maybe do something about it.
Yeah, thank you. And I'll just build off, the recent government shutdown. It was the longest in history, and it put benefits at risk for 5.3 million Californians. And not only did people not have access to food benefits on November 1st through 7th, but even the people who, might get their benefits on the 8th through 10th, there was still that real fear and that confusion that we just talked about a little bit. And so, it had a real impact on people across the state and also on a lot of businesses and local economies. Statewide, every month, about $1.1 billion goes out on food benefits. And so this had a real impact on people across the state. And just to put in perspective, about 63% of CalFresh recipients are children and older adults. And even a small delay in benefits can have real long-lasting impacts, especially for children. And at the state level, the California Association of Food Banks, we have 42 member food banks, and we're still working to gather all the data about the impact that the delay in benefits had, but also, the delay in paychecks that people had, both, federal workers and also active duty members. And so as we work together that data, I can share that just anecdotally from some of the food banks that I've talked to, they've seen about a 20 to 40% increase in need at their food banks. And so the impact is real, and hunger is heightened during this time. But we also know that data is not the only way to document harm. It's important to put faces and names and stories to the people who were impacted by these delays. I think, all of us in this room could probably know like a family member or friend or a customer that you helped that said that they had to make the hard decision between paying a bill and paying for food, or not eating so that their children can eat. And those stories are heartbreaking, and it's important that legislators know, and so that they can really see the impact that this is having in their community. I know I was just in DC this past week, and that was something that a lot of legislators were asking about is what is this real harm that's happening in my community and who is it impacting? And then I'll also say, another way to document harm is sometimes photos, if you have consent. I know I still remember the pandemic and seeing long lines of cars at food banks, and those photos still they stick with me. And so that's another way that you can document harm, in addition to going on the radio and talking to the media or doing op-eds and just really getting the word out there. Not only does it start to educate legislators, both at the state and the federal and the local level, about what's going on, but it also starts to create public pressure, as I think a lot of us saw this time around. Maybe not all of us are on TikTok, but even on my TikTok, people were talking about SNAP. And so I think that just really helps to show the pressure and the importance of programs like these. I think the shutdown really reminded people how critical the SNAP program is, both for the community members that they serve, but also for the grocery stores and the farmers markets. Just last week, I was talking to a farmers market that said that they only had a few people visit the first week of November because they're relying on CalFresh recipients to go. And so building that community and showing those perspectives of, it's not just a family on CalFresh who's impacted, but it really is the whole county, the whole state that's impacted, is really important. And then, I just wanted to name that, in addition to letting legislators at the state and local and federal level know about the importance of the SNAP program and what happens if we don't protect it, this shutdown really reiterated how much food banks and food pantries are there to support people in need, whether it's a natural disasters like the floods that San Diego saw not so long ago, or a man-made disaster like these shutdowns. It shows the complementary impact and aspect of both of these programs and why we need to work to advocate to strengthen both of them. And I'll just end by saying, although the SNAP program is going to be funded until end of September 2026, it is not guaranteed that we won't see this again in October. They did replenish the contingency fund, which the USDA, the Department of Agriculture, can use to help people's benefits continue during a shutdown. But they didn't guarantee that the USDA would use its transfer authority to ensure that full benefits go out. And so that's why it's really important that we continue to share the data, the stories, and talk about this issue. That way we're ready if this happens again, just to really show that food should not be used as a political weapon. Thank you.
Thank you, Gabby. And thank you also for pointing out that there was $1 billion every month in CalFresh benefits. And so when we're thinking about who is this affecting, not just families, and there is a bigger economic impact. I was wondering if Blanca, you could talk a little bit about the disruption to our local grocery stores and our food systems when SNAP is disrupted.
Before I answer that question, I think all this information feels pretty overwhelming. But I want to go back to what Benjamin said at the end of his first answer, and it's that we have each other's back. And we need to keep doing this work. I think we need to thank the Hunger Coalition and thank North Carolina for the advocacy. We need to thank our local foundations for stepping up, supporting our food banks, our farmers, Food Shed. I saw it in the news last week. And also the County of San Diego. I do have to give a shout out to the Más Fresco Plus program. They funded that program. It's a nutrition incentive program. You don't need to be on SNAP. All you need to be is in need of food. And this was an advocacy from American Heart Association and County Obesity Initiative Community Council and many, many partners. And to date, we've been distributing over close to 80,000 produce boxes. We've served over 3,000 households, and we generated over $3 million in the local economy. So we need to keep doing more of this. I do want to say that we don't talk often about the impact of SNAP in the economy. And during the shutdown, I saw a lot of media, including on TikTok, saying that, why are 42 million Americans on SNAP? And somebody said, well, we shouldn't be asking that question. We should be asking, why is it that 42 million Americans are eligible for SNAP? That is the question.
And because we already know that 70% of the working age SNAP recipients work, that's the majority. And not only do they work, but they work full-time. 1 out of 5 work in education and healthcare. These are the people that are teaching our children, taking care of our kids, running our clinics. So if 42 million Americans are SNAP, it's not because they're failing. It's because our economy and our government are failing them. I do want to say that there's a couple economic aspects that I want to mention. Some critics say that SNAP is a corporate welfare program. And because employers are not paying livable wages. And the reality is that wages have not kept up with the cost of living. You know, housing prices and childcare and utility bills and groceries skyrocketed, but wages continue to be pretty much flat. So when an employer chooses to pay their staff wages that are so low that even if they work full-time or part-time, they cannot afford food, that's when taxpayers come in. Because we need to make up for that wage gap and compensate, because we're not going to let our people go hungry. We all believe that food is a human right. So who's really benefiting from all of this? Corporations are, because they get labor, they get profit, they have stability, and they get away with not paying livable wages. An interesting fact that I just learned is that 1 in 10 SNAP recipients work in large grocery stores with 1,000 employees or more. And the total SNAP redemption is almost $100 billion a year. And did you know that Walmart, their total grocery SNAP spend is $20 to $25 billion? And then you add Kroger and Amazon and Costco and Sam's Club, and together they account for another 20 to 25% of the total SNAP spend. And then, of course, we have our smaller retailers and farmers that account for a very small fraction in comparison. So the problem is not that people are in SNAP. The problem is an economy where you can work part-time or have 2 jobs and still not afford food. Another interesting point is that we heard earlier that for every SNAP dollar, it generates 1.5, 1.8 in economic activity. So we know that when SNAP gets cut, we're going to see an impact in our entire local food system. Grocery sales are down, farmers market sales are down. It affects our local farmers, our crops. Our food banks get overwhelmed. SNAP provides 9 times more food than our entire food banks combined in the entire country. We don't have the capacity to meet the demand when hunger gets redirected locally. So this is why economists who usually disagree on social programs, they see the SNAP program as beneficial and as one of the best, if not the best, economic investment in our local economy. National Grocers Association has said that SNAP is the lifeblood of retailers. And I just want to end with a reflection. Last week, my team and I were talking about the Greenwood food blockade. This happened in the early 1960s in Mississippi, where Black families were denied food. They were removed from food assistance commodities because they were voting. This created an outrage. Doctors, elected officials, leaders elevated this at the national level and pressured the government and Congress to take action. As a result, this was a catalyst for the existing, at that time, food assistance pilots to be extended throughout the country, including Mississippi, and that became what we now know as SNAP formally, to make sure that, local government didn't have control or couldn't decide who and why, people should eat. So when we talk about SNAP cuts and shutdowns, when we deny food to immigrants and refugees and humanitarian immigrants, we are reopening the door to the same harm, to deny food to people because of racism and because of a political agenda. And my reflection interpretation of this is that there are a lot of parallels, but SNAP is not just about improving food security. It's not just about improving health. It's not just about helping our local economy. It's also a protection, because we all believe that food is a humanitarian right? That it's not something you earn through productivity.
So to me, SNAP is the protection that makes sure that no local, state, or federal government could weaponize or should weaponize hunger again.
Thank you, Blanca. I really appreciate everything that you have said so far. And it is, I didn't want to close this panel and the questions without addressing what you were just talking about immigrants, about how our families are feeling right now, the increased fear and the confusion for many families that are part of our country or our state. And I want to hear from you, Ben. What are you hearing from communities about the shutdown? How is that impacting trust? And how is that impacting access, like families actually going and searching for those benefits or looking, even if they are eligible, but how is that being impacted?
Thank you. Yeah, I've been reflecting a lot on the government shutdown, especially while it was happening. And one thing that really stood out to me was the narrative happening at Congress where Republicans were blaming the shutdown on the Democrats trying to push for healthcare for undocumented immigrants. And we knew that that was a flat out lie. That wasn't a part of the negotiations. But I think really just shows how not only is food being used as a bargaining chip to kind of get folks to yield to the new administration, but immigrants continue to be scapegoated and are, a political boogeyman. Despite those lies, I think the numbers from HR 1 kind of tell the truth pretty plainly. Billions of dollars cut from SNAP, from Medicaid, from Medicare, billions of dollars in tax cuts and additional loopholes for the wealthy, and an increase in billions of dollars to immigration enforcement. So we saw where that money was being traded. This is the foundation of the terrorizing of our immigrant communities we're seeing today. So with the government shutdown, closing the door on SNAP benefits, mind you, millions of folks have been excluded from SNAP benefits due to their status, so the door was never open for them either. There's been a breaking of trust with the community. And so even with this increase in mutual aid, folks trying to go to their last resorts like a food bank. Hello, okay. We were hearing reports of people not feeling safe to leave their homes beginning in June. The need to basically operate in some sort of clandestine way, like an underground sort of food distribution. For households that were eligible for SNAP, folks were impacted like every other household. One thing I wanted to share with you all was just what it looks like to be excluded in the long term. And one thing we were able to do at CRPC was work with the Public Policy Institute of California last year to measure the poverty rate for undocumented Californians. And what we found was that 37% of undocumented Californians who have been historically excluded from SNAP are under the federal poverty line. And I think many of us know that when you're on SNAP, that's an anti-poverty sort of factor, and it helps people not experience the worst of being low income. But we looked at different regions across the state, and we found that that rate was higher, the highest in San Diego. It was 44% of undocumented folks in San Diego experiencing poverty. Compared to the statewide average, we found that nearly half of undocumented immigrants are experiencing food insecurity, and if there's a child in the household, that rate is 2 out of 3. And so that's from decades of exclusion. And I think, over this past month where everyone was having their SNAP benefits compromised, I think that was felt more widely. I guess just to kind of close, I just want to really just highlight how this past year, it's been so overwhelming. I think people are, waking up to the fact that we have to lead with an alternate solution and look at this more systematically. So as I mentioned, a lot of the funding for SNAP was diverted for additional tax breaks. And so looking ahead in California, our work is focused a lot in Sacramento. There needs to be a conversation about how do we close these gaps, close the gaps that are new because of HR1. How do we close these gaps that have been wide open for decades? One moment of history that I look towards was the passage of welfare reform in the late 90s. And 1 year after that, leaders in Sacramento stepped up and created the California Food Assistance Program, which is our method of delivering state-funded food benefits to folks beyond who is eligible at the federal level. Folks before us rose up in that moment to do what we can to look at additional ways to resource the needs, because the needs aren't going away. And it's my hope that over this next year, given the success of progressive voices across the country, we can do something similar at the state level or at the county and city level as well. So hopefully this past year is a turning point.
Thank you, Ben. I had invited a community member to come and share a little bit of her story so that we understand that the CalFresh is a program that creates positive energy, that creates growth and benefits. And she was not able to be here because she had an emergency with her son. She sent me her story and asked me if I could please read it. So I'll take a couple of minutes to read her story. She said, "Good afternoon. My name is Maribel, and I want to share a small piece of my story with you. I am a person who believes deeply in well-being, physical, mental, and emotional, for myself and for my children. I love learning, growing, and taking care of our health. And as a mother, my greatest priority is making sure my children are well and that they have good quality of life and that they grow up surrounded by love. My children are responsible and loving, and I'm very proud of them. My dream is for them to go to college, and I also want to go to college. I am studying English and taking classes to earn a degree in business. Before receiving support, life was very difficult. I worked many hours and took care of everything at home. Sometimes it was very hard to buy food. I bought only the basics so the groceries would last a week. And sometimes we limit ourselves to one yogurt a day so that they would last all week. I was exhausted and working 2 jobs. When I started school, my paycheck was not enough for rent and transportation. The school told me about CalFresh for my son, and applying online was easy and fast. I didn't apply for myself because of immigration concerns and because I am very independent. But applying for him made an enormous difference. With CalFresh, my children don't get sick as often. They have more energy and they go to school well fed with healthy food, and that shows in their learning. It feels great to choose food that truly nourishes them. CalFresh has given me a stability, peace of mind, and the chance to study part-time, work part-time, and be present for my children. I manage the benefits carefully. Now I can pay my rent and transportation easier. The program can truly change your life and your opportunities. I am a mother guided by clear values: love, generosity, excellence, positivity, and integrity. I am grateful for programs like CalFresh that support families who are working hard and want to keep growing. To other moms facing difficulties, I say, please explore this support. When a mother has less stress, her children feel more safe, loved, and supported. Thank you. I just wanted to say a big thank you to our panel, and please share, say thank you with me. And then I also wanted to say a big thank you to all of you, because thanks to you, your advocacy and the work that you do for the community, it's a big help for all these families, and you're making a huge impact on the life of many children and many families. Thank you so much.
Thank you, Antoinette. Thank you, panelists. Show us a reality without sugarcoating it. We saw the growing meal gap. We saw where participation in SNAP, WIC, and summer ABT is strong, and where communities are being left behind. We saw what happens when federal protections weakens and how quickly families feel the impact. But we also saw something else. When our sector works together, we move the needle. We increase access, we help more people put food on the table. When I attend national events, colleagues immediately recognize what our 500 partners are accomplishing here in San Diego. That's the work of the Hunger Coalition, and it's the work of every organization in this room. Your presence today matters because policy doesn't change its own. On its own. Systems don't fix themselves. It takes all of us, researchers, service providers, food banks, schools, elected officials, advocates, and community leaders, each playing our part, aligned in the same direction. And the work, it's very heavy. You see the stress on families, you hear the hard stories, you do the screenings, the applications, the follow-ups. You sit with people on the hardest days of their month, and still you show up with dignity and care. Thank you, all of you, for that. And as we close, I want to leave you with this. Hunger is solvable. And San Diego has already shown what is possible when we coordinate, when we rely on accurate data, and when we refuse to let anyone fall through the cracks unnoticed. So let's keep pushing for policies that actually work for real families. Let's bring more people to SNAP, WIC, and summer EBT. Most importantly, let's keep having each other's backs the way this sector has always done it. Gracias a todos y todas for your time, your partnership, and your commitment to a hunger-free San Diego. We're very, very proud to do this work with you. And now I'm going to pass it back to Sarah, who has a few.